By the end of my speech, you will have knowledge of a few different types of insomnia and what you need to do if you are experiencing any of the symptoms. Dr. Neubauer of Johns Hopkins University School of Medicine says that excessive stimulation and caffeine can be some of the causes of insomnia. There are as many as 30 to 35% of adults complaining about insomnia. Today, we will discuss first what is insomnia and its symptoms. Next, types of insomnia and its causes. Then, diagnosing insomnia and its treatments. Much of the information that I'm going to share with you today came from the National Sleep Foundation, WebMed, and sleepeducation.org. Insomnia is a sleep disorder that's characterized by difficulty falling asleep or staying asleep. People with this sleep disorder can have one or more symptoms. Your symptoms can include difficulty falling asleep or staying asleep, waking during the night and having trouble falling back to sleep, lack of concentration or feeling irritable, and even being tired upon waking in the mornings. Primary insomnia and secondary insomnia are two types of insomnia with many subtypes. 15 to 20% of people have primary insomnia. A person with this type of insomnia is having sleep problems that are not directly associated with any health condition or problem. Acute insomnia would fall under this type of insomnia, and some of its causes can be stress, illness, jet lag, and even some medications. Chronic insomnia falls under the secondary insomnia type. And this type of insomnia has underlying conditions and problems. It's usually long-term, and it's considered chronic if it occurs longer than 3 months. Some of its causes are depression, anxiety, and chronic pain. And 10% of people have this type of secondary insomnia. Now, to get a diagnosis of insomnia, you must first talk with your healthcare provider, and they will run the necessary tests to better understand how to treat the disorder, or if you even have it. He or she can give you a physical exam, take your medical and sleep history, and they may refer you for a sleep study at a sleep center. Depending on the severity will depend on the treatment. For acute insomnia, your healthcare provider may suggest a sleep hygiene, which is a ritual of practicing good sleep habits. For chronic insomnia, they will first treat the underlying condition or problems and suggest behavior therapy to teach you to change the behaviors that may be causing the insomnia. First, we talked about insomnia, what it is, and some of its symptoms. Next, we discussed the types of insomnia and what we may be doing to cause it. Then, we talked about how to diagnose and treat the different types of insomnia. And finally, if you feel you may be in this elite club, then talk to your healthcare provider and start your sleep hygiene ritual by logging your sleep habits. Remember, good hygiene isn't just taking a shower.